3 minutes left. We'll
Okay.
begin.
We can wait for 3 minutes. Let all
Okay.
the candidates join. Because
Okay,
right
ma'am.
now I am in Parvani. I am not at my place. And here
Okay.
I have lot of students in my medical college. I shared the link with them also.
Okay.
But practical exam is going on. I'm here for that exam. So they will
Okay.
also join. So wait for
Okay,
2
ma'am. Okay.
That's okay. Action start.
Okay, ma'am. I'll just quickly go through the introduction. I'll share my screen. Hello. I welcome you all to Homeopathic Musings. A very happy new year to all of you who've joined. Before starting the session, just having a quick look at the upcoming modules on Homeopathic Musings. So, in this year 2024, we'll be having animal series, the jungle safari that we will be starting in January itself. We'll have different speakers speaking about invertebrate, vertebrae on earth, air, water. So do join us. The early bird is going to end real soon till the 12th of January. To make the most of it. We have the insect series, which we'll be starting as a part of the animal series. We'll be having total 4 sessions all Thursdays at 7 p.m. starting from the 18th of January, where you learn the less known insect group through the concepts of sensation, PEM, biological characteristic, superclass, keynotes, and proving. The early bird is again till the 12th of January. So do register. We also have rheumatism management on the 24th of Feb, which will be taken by Dr. Ashok Bodkar at 6 p.m., where he'll be discussing about different rheumatism management cases in homeopathy. We have a 6-month long course from classroom to clinic, specially designed for students and early practitioners, which will be starting from March. We'll have total 18 lectures, Wednesday, 7 p.m. The early bird we've extended till the 15th of January. We'll have personalized hand holding training through mentoring sessions. We'll have complementary synergy software for 6 months given to students. Complimentary clinic startup kit will be provided. You'll get to attend a lot of live cases. This will be a really good learning experience to students and early practitioners. Moving on to today's session, this is our first homeopathic musing session for 2024. I welcome Dr. Kavita Chandak, where in the session she'll be discussing about the chronic cases managed by homeopathy with quick results. About the speaker, Dr. Kavita is a passionate young homeopath honored by 3 Golden Book of World Records for treating kidney disorders and success in a case of mucormycosis. She is an author, international trainer, speaker, promoter of homeopathy. Practicing since 1999, she is specialized in autism, psychiatric and behavioral disorders, kidney diseases, and cancer. She is an advisory board member for a journal in Istanbul. She has been invited as a speaker for many international seminars and conferences. She has authored total 8 books. These are the books that she's authored. She's also had online courses, and she has been awarded for her socio-medical contribution. She received various prestigious awards, including the recent one, which is Excellence in Homeopathy 2022 by hpathy.com. Her email address is listed down below with her website in case anyone wants to contact. Quickly going through the basic hygiene factors: mute your lines all the time, keep the videos on for an interactive session. Please do not interrupt when the speaker is speaking. In case you have any questions, you can jot it down in the chat box below and we'll address it at the end. Do not scribble on the screen, make notes, share your experience and enjoy. In case of any difficulties, feel free to contact us. I'll hand over to you, ma'am. I'll
Thank you,
stop
Taksim.
sharing.
Thank you. Thank you. So, good morning, everyone. And first of all, Happy New Year. I'm going to share my screen. Okay. Okay. Taksim, is my screen visible?
Yes, ma'am, it's visible.
Because I can
In
see
case you can just put it on a wider this thing. Full screen, I mean.
no, it is convenient for me. I usually share this much only.
Okay. Never mind.
Because I should know how many slides are remaining
Right.
to calculate the time.
Right.
So, everybody, I'm here to share about quick results of homeopathy in chronic cases from Organon to Materia Medica. The basic thing and the basic question which I am facing in all my international webinars, seminars, in college seminars, everywhere is that why to study Organon when we have Materia Medica and repertory? You see, in practice, people think that, especially the budding homeopaths, they want sure short success in a short time, and they want to practice with homeopathic Materia Medica as well software. But homeopathy practice is not so easy. You see, if a student of first year will prescribe something to any patient, he will provide 40% relief. But this is palliation. This is not cure. For cure, you have to build your building on this strong base. And the strong base is homeopathic philosophy. That is Organon. And trust me, when you enter in your cases through Organon, you get quick results. And today, you all are going to witness the quick results of homeopathy in chronic cases when you enter from Organon to Materia Medica. Today I will discuss 50 years old allergic tendency treated by homeopathy in just 3 months, a chronic case of 6 nerve rectus palsy, diplopia and migraine solved with homeopathy in just a month, then chronic inflammation of mandibular temporal joint, headache, acidity and bronchitis treated with homeopathy in just 2 months. Justification of prescribed remedy you will get with the differential diagnosis. Importance of Organon in handling complicated cases. And strategy to reduce the recovery span and to get quick results in chronic cases. Today I will discuss all these things because I observed in my seminars many doctors consider that chronic cases take long time to show positive changes. Hahnemann mentioned in chronic diseases and Organon about the strategy for quick and better results. So here today we are going to uncover that part of Organon. First of all, let me ask you all, what is homeopathy? You all are free to answer. Either you can open your mic or you can type in the chat and Dr. Taksim will read it for you. Because it is an interactive session, I don't want to talk like quack for 2 hours. I want you to put your inputs.
One has answered similia, similimus, curator.
Thank you so much for the bookish answer. But any other answer? Okay. Homeopathy is a wonderful science based on the natural law of similia, where we treat the others as we would wish to be treated, and hence we call it as a science of the individual. So this is the beauty of homeopathy, where you treat the others as you would wish for yourself. That you know, if you want to earn respect, first we need to learn how to pay respect. This is same with homeopathy. When a doctor feels the empathies of the patient, the agonies of the patient by putting himself on that place. This is homeopathy. Now, what is this? Do you have any idea of this picture?
Chakras, 7 chakras.
For what I mentioned it here? Human being is the combination of mind, body, and soul, which we consider as a feeling. Feelings are not visible, but when they get hurt, we suffer from various disorders. Basically, it is the immunity who becomes sick, not the body, mind, or emotion. So, first of all, make it clear that you are going to deal with the immunity of the person, not with his body, not with only his mind, or not with only the feelings. So, it is the combination of all three. And how immunity gets damaged, how diseases occur. Before dealing in abnormal, we must know what is normal. Before pathology, we must understand the physiology. Human being is the best creation of God. Every person is blessed with supernatural mind, which individualizes us from each other. Mind has lot of feelings, reactions, and responses to the environment. There is a great balance between mind of an individual and the nature. When any emotional deviation occur in mind, this balance between mind and nature gets imbalanced, which disturb the harmony. Any deviation from normality to abnormality in mind and feelings leads the patient towards psychological ups and downs, which in turn land you disorders. Mere presence of pathology is not disease. Just removal of pathology is not health. We have to balance what is imbalanced. And that's why we are here in this planet. This is the duty of homeopaths to tune what is mistuned. Humans are caught in the delusion of the physical world. We want to believe only in what we see, touch, smell, and feel. But there is so much more to existence than this. In order to conceptualize homeopathy, we must detach from the purely physical world. Sometimes patients' investigations are absolutely normal. Still, patient feels uneasy. For example, a couple consulting for infertility has no abnormality in all lab investigation. They both are normal. Then what is stopping them from being conceived? Or a man visiting with deadly headache has normal MRI or CT report. What is there behind this headache? So it is our duty to find out which the machineries are not able to find. Diseases are not only caused by substances like bacteria, viruses, fungi, toxic matters, etc., etc., as is the main belief in conventional medicine. But that every substance can also cause an imprint in the dynamic, energetic field of the person. So, how the diseases transfer? The way of disease transmission are three. The first is hereditary transfer. We call it as a direct damage to the person or it may be through the emotional trauma. Child receives half of its gene from each parent. These imprints are not only from direct damage to the person, example, by vaccination, a disease like influenza, but even for emotional trauma, like death of a child or recent divorce, can also be transmitted from the parents to the unborn child. It is not only disease itself or the causative substance that is transmitted, but rather the energetic imprint in the energetic field of the future father and the mother. Second way of transfer is substance transfer. Toxin can pass through the umbilical cord during pregnancy, including heavy metals, drugs, and drugs the mother takes, alcohol, tobacco, toxin products in her food, etc. etc. Once the baby is born, toxin can enter via its food. You can say through breastfeeding or through the bottle feeding. See, these are the medication or breastfeeding. Then even by inhaled air, the freshly painted walls, even the paint which carried lead poison. So the child could be able to expose himself to the lead poisoning, heavy metal toxicity, through its delicate permeable skin, like by using shampoo, soaps, creams with parabens, ethyl glycol, etc., etc. And by some medications like antibiotics, anesthesia, and no doubt the most controversial thing, that is vaccine. Third way of transfer of diseases is dynamic transfer. Substances that are toxic can damage the unborn or young baby not only by their material toxicity but also by creating an imprint in the baby's energetic field, in its vital energy. Diseases can do the same. But the toxic substance can leave an energetic imprint that lasts even after the material substance is no longer present, especially after long term exposure to the toxic diseases. Toxic substance can cause acute reactions when its concentration is high. Gradually, its concentration diminishes, causing decrease in toxic effects, and finally disappear completely, but by leaving its imprint in your immunity, which is the soil, the basic fundamental reason, the basic miasm of your body on which the diseases can precipitate itself. Why I explained these things? Because you should understand how the diseases are landing in your personality. Then only you are able to remove them. Generally, toxin can have lifelong effects if irreparable tissue damage has taken place, or if the toxin has provoked an energetic imprint in the energetic system, that is, vital energy of the patient. What is acute disease? The main characteristics of acute diseases is their tendency to heal on their own, as mentioned in Chronic Diseases, the book written by Dr. Hahnemann, which is our Bible. They have a destination and therefore a defined beginning and defined end with or without treatment, with medication or homeopathic remedy. But chronic diseases are different. In the case of chronic diseases, on the other hand, self healing is not possible. The organism grants them unhindered access and cannot eliminate them on its own. Chronic disease progresses in the phases, sorry, chronic diseases progress in the phases. There are latent periods between relapse where symptoms flare up, time, and again in a more or less modified form with new symptoms. That is, increase in the ailments every few years. In the other words, chronic diseases don't end until the individual dies. But homeopathy has the ability to end it up because Hahnemann worked for 12 years. From the from the early days of his career, Samuel Hahnemann experienced great success in the treatment of acute diseases. But as early as 1816, he was becoming concerned because the constitutional health of his patient seemed to be slowly declining. As he pondered the nature of his constitutional deterioration, in his patient, he began to search for a deeper understanding of the processes that lie behind the chronic diseases. And this study actually took him for 12 years. Of these chronic cases, he lamented, their beginning was promising, the continuation less favorable, the outcome hopeless. Hahnemann began to wonder about the cause of these complicated chronic diseases that were resisting his treatment. For 12 years, Hahnemann quietly searched for the fundamental cause of the chronic diseases that was slowly destroying the health of his patients. The outcome of this research was published in 1828 in the first edition of this great work, The Chronic Diseases, the peculiar nature and their homeopathic cure, commonly today known as the chronic diseases. Now, I explained about the difference between acute and chronic diseases. Now, what happens? Sometimes many patients approach a homeopath with chronic diseases for which they are struggling for the years. They are landing here and there, playing doctor, traveling through all the paths allopathy, Ayurveda, homeopathy, naturopathy, aroma, everything. And ultimately, they come to you with the ray of hope that you will definitely relieve them. If you learn organon in depth, you will be able to relieve them in just few months. Let us meet here a 50 years a patient who has suffered from 50 years from the allergic tendency and homeopathy treated her in just 3 months. A 67 years lady visited me for her chronic headache and allergic tendency towards almost 40 to 45 things. She had not consumed green vegetables, ghee, chena, sour food, fruits like grapes, apple, pineapple, curd, buttermilk, tomatoes, cardamom, desserts, and many more food for 50 years. If it will happen with me, it is the biggest curse. I will prefer to die instead of not eating all these things. Understand? But it is really difficult for the patient. And this food used to create hammering headache lasting for 3 to 4 days. Homeopathic medicines cleared all her allergies within 3 months. She underwent various medications and finally gave up. I considered her physical, mental, and emotional symptoms, major illnesses she suffered from childhood, and her family history, like any disorders in parents and siblings, for selection of appropriate remedy with respect to her individuality. These rubrics were considered allergic constitution, diet, errors in diet aggravation from the chapter food and drink, delicate constitution, hammering headache, and milk aggravation, and diet aversion from the ordinary diet. In this case, the keynote to enter in this case was ordinary diet, aversion to ordinary diet, because she was not even able to eat apple, which we suggest an apple every day keeps the doctor away. For us, people usually say this thing, but she was not able even to the immune throat. So my first prescription for this case was Ignatia. Of course, I consider her totality. Follow up after 15 days. She started eating few things, but observed headache and swelling less in intensity this time. But ultimately it was there because you cannot erase all the toxins or the bad effects, allergies from the constitution in just 15 days. I counseled her to continue eating all food and just placebo was given. Follow up after a month, her daughter-in-law said she is eating everything if she is unaware about it. I changed oil as per your guidance without letting her know she is fine with that. I put various ingredients like cardamom in food. She had no allergy. Now she is able to drink buttermilk. If she does not know what has been put in the cooking, she is fine. Sometimes even psychology plays a role. If I tell her, then she feels headache. I gave her Ignatia 10 one dose. Now see follow up after 3 months. The old woman came and asked me, can I touch you? I want to feel how God could be. Because for her, I was God. The things which she was not able to eat for 50 years, now she is eating everything. She said, you are a godly person. You changed my life. I never thought that I could taste anything until death, but you gave me an awesome life. Thanks to you and your wonderful science. Why I did not approach a homeopath first?
पहले सिर्फ दाल रोटी खाते थे ये, लेकिन अभी सब चीजें उन्होंने शुरू कर दी है, सब चीज खट्टा दही छाछ।
कितने साल तक के सिर्फ दाल रोटी खाई?
40 साल हो गए दाल रोटी खाते हैं।
और क्यों नहीं खा रहे थे अपन बाकी चीजें?
सिर दर्द होता था मुझे बहुत ज्यादा, एकदम हथौड़े चलते थे 3 दिन। डॉक्टरों की दवा से भी फर्क नहीं, से उबलता पानी से सेकते रहना पड़ता था।
अच्छा।
वो 3-4 दिन के बाद वैद मामा की दवा ले लेती, लेकिन अभी मैं सब चीज खा रही हूँ। घी बिल्कुल नहीं छू सकती थी मैं, प्रसाद इतना सा चिमटी भी नहीं ले सकती थी, पेड़ा वेड़ा, ये अभी मैं सब चीज खा रही हूँ।
अच्छा, यानी 50 साल तक के अपन ने क्या क्या चीजें नहीं खाई, उसके नाम बताइए तो मुझे।
घी है, अंगूर है, छाछ है, दही, खट्टी चीज मतलब सेब नहीं, कोई चीज नहीं, पाइनएप्पल नहीं, कोई भी फ्रूट। पालक भी 2 पत्ती बस,
2 पत्ती पालक, यानी पालक की सब्जी भी नहीं खाते थे?
कुछ भी नहीं। टमाटर भी डालो तो मतलब तकलीफ होती थी।
यानी ग्रीन वेजिटेबल 50 साल से खाया ही नहीं था?
सिर्फ पालक की
2 पत्ती, वो तो काउंट ही नहीं होती, वो तो संभार जितनी होगी भाभी।
पूरे घर को मेरे कारण उनको भी कम बेचारा।
अच्छा, और इलायची वगैरह?
इलायची भी वो तो 30-35 साल से बिल्कुल बंद था मेरा सब।
ठीक है। और अभी अपन जैसे आपका ट्रीटमेंट मैंने 14 फरवरी से शुरू किया है और आज 11 अप्रैल है, तो ऑलमोस्ट 3 महीने भी होने को 2 दिन बाकी है। तो अभी आपको परसेंटेज वाइज 100% में कितना फर्क पड़ा है आंटी?
80% तो पूरा फर्क है।
और अब वो डर लगता है कि मैं कुछ खाऊंगी तो मेरे को कुछ हो जाएगा, चक्कर होंगे या सिर दुखेगा?
ये डर रहता है, लेकिन मैं खाती हूँ, मुझे कुछ होता नहीं है।
होता नहीं है, चलो बहुत बढ़िया। मुझसे मिलने के पहले होम्योपैथी कभी लिया नहीं था क्या आंटी?
लेती थी दीदी मैं।
अच्छा।
तो बुखार मुझे पहले से बहुत होता था।
हाँ।
तो एडवर्ड डॉक्टर से ही होम्योपैथी देते थे।
पर उसमें भी एलर्जी निकली नहीं, टाइमिंग सिर दर्द दबता रहा, एलर्जी जहाँ की वही रही। तो 50 साल तक के अपन ने कुछ खाया पिया नहीं फिर?
35-50 साल हो रहा मेरे को, तो लगता है मैंने कुछ खाया नहीं।
आप दूध लेती थी 50 साल में? ये 50 साल में दूध
लेती थी मैं। हाँ। और अभी तो दूध भी बंद हो गया था मेरा 6 महीने पहले से, एसिडिटी बहुत बढ़ गई थी तो।
ओके, तो अभी वापस शुरू किया होम्योपैथी ट्रीटमेंट के बाद?
हाँ, सब शुरू।
अभी सब खा रहे हैं आप जो घर में बनता है?
कच्चा दही, पूरे फ्रूट्स और घी, प्रसाद, पेड़े वेड़े सब खा रही हूँ रोज।
अब ज्यादा ही मजा कर रही हैं। लौकी
दही कच्चा कभी खाती नहीं थी, दही भी खाया, सारी चीजें खा रही हूँ मैं, सारी चीजें।
तो आपको क्या लगता है होम्योपैथी ट्रीटमेंट में आने के बाद में आपका फीलिंग क्या है होम्योपैथी के लिए और मेरे लिए?
यही सोचती थी जिंदगी में कभी मैं कोई चीज छू नहीं पाऊंगी, लेकिन मुझे बिल्कुल नई जिंदगी मिल गई।
चलो बहुत बहुत धन्यवाद।
होम्योपैथी दवा से तो मैं वापस जिंदा हो गई।
थोड़ा क्रेडिट डॉक्टर को भी दे देते।
आपसे ही तो हुआ है, अगर यहाँ नहीं आते तो हमको ये सब चीजें कहाँ से मालूम?
आप तो मेरे लिए बिल्कुल भगवान हो, बिल्कुल भगवान। मैं सोची नहीं थी कि मैं कभी ठीक हो पाऊंगी, कुछ खा पाऊंगी दुनिया में।
थैंक यू।
ऐसे मुझे डॉक्टर मिले, ऐसा
थैंक यू सो मच। आप बहुत बहुत धन्यवाद कि आपने होम्योपैथी में ट्रस्ट किया है। थैंक यू।
So this is our patient. We all made up of 5 elements. You know, in India we say that we are made up of Panchatattva. We are the combination of minerals, microbes, gases, metals in a particular unique blend. This unique combination gives us our individuality. If anything from this unique blend falls out of balance, diseases or allergies can develop. Homeopathic medicine cleared her allergies within 3 months because I just balanced her unicity. I just balanced her individuality. I worked on her immunity. So who says now that you cannot cure the chronic disease in just few months? Now meet the second patient. This is a chronic case of 6-nerve rectus palsy, diplopia and migraine solved with homeopathy in just 1 month. 6-nerve rectus palsy is the most common ocular motor paralysis in adults and the second most common in children. Surgery in this case can lead to complications. A 43-year male presented with history of distant double vision for 2 months associated with severe left-sided headache and neck pain with pain on movement at 26 October 2022. He is a known case of hypertension for 10 years and taking medication for the same. He went to allopath and got the diagnosis of right lateral rectus palsy that is esotropia, fixed nerve palsy, or ophthalmophagic migraine. He used to work in Goa as a chartered accountant, and the company kicked him off after the trouble. So he had to left his job and he came back to Nagpur. And this is the report which he performed in the Goa. Here you can see the diagnosis which I just mentioned you. He said, I have double vision. I see two images of one object. My vision is blurry when I see with my both eyes, but it is clear when I close my one eye. Doctors diagnosed me having horizontal diplopia. I can see an object with its image besides it now above or below. It's not above or below. He can see the besides but not above the below. I'm using prism glass as advised by ophthalmologist. I get frequent headache which increases with noise. Have to turn off the lights during headache. If I hold urine, I get headache. I'm introvert, fearful person. Can't make decisions without my mother or wife. I'm sensitive, cannot watch emotional scene in the mobile. It makes me cry. Any bad news worsen me. I feel better after crying. I try to hide my feelings as don't want to be embarrassed among people, but my heart keeps on pumping loudly. I feel weak though eating well. So analysis of this case was, during an interview, I understood that this man is a simple, fearsome, withdrawal personality who wants harmony and peace. Slight emotions shake him. I considered the following rubrics: elements from bad news, elements from embarrassment, elements from fright, stage fright, anticipation, weeping, cervile, complaints of temple, heaviness, profuse, urination, amelioration in the head chapter, and head complaints of head accompanied by stiffness in the neck. Diplopia looking sideways, not up and down, just sideways. Diplopia paralysis from paralysis of muscle, diplopia of horizontal object. In general diplopia, vision blurs even after having adjusted the glasses. Because he was looking through the prism, still diplopia is there. And he had spectacles also. So many remedies came up like gelsemium, nitramute, sulfur, sepia, lycopodium came up. But I prescribed him gelsemium 200 CH one dose. Could you please tell me why I chose gelsemium? Yes, doctors, come on. I told you the name of the remedy.
Suresh is writing headache relieved by profuse urination.
Very good. It is a keynote symptom of gelsemium. And anything else?
Nervous, fearful nerve involvement. Written by Shruti.
Okay. Anybody else? It is solid answer.
Anxiety, anticipation stage.
Because I wrote
Gelsemium good for
Hmm.
neurological disorder.
You know what? For what gelsemium is famous for? Why do we use gelsemium frequently in our practice?
Dullness, fright,
And
bad news.
yes, and there is 3D
Headache
in
with
headache,
blurred
ma'am.
vision.
Headache with blurred vision or headache preceded with blurred vision?
Dullness, dizziness, drowsiness.
Exactly. The 3D is dullness, dizziness, drowsiness, and it is the very famous remedy for examination funk, right? Which are the other remedies for examination funk?
Silesia argentum nitricum.
Silesia, I don't think. Argentum nitricum is the correct answer. And one or two
Someone is
more.
writing arsenic.
No. Gelsemium, Argentum nitricum, Carcinosinum, and Taxus baccata. These are the four remedies which we use in our practice for examination field. I repeat, Gelsemium, Argentum nitricum, Carcinosinum, and Taxus baccata. Now moving forward, his mental favored nitramure, but it did not cover the chief symptom about the vision. Nitramure patient is not submissive. Then the other remedy which came up in this chart was sulfur. But sulfur do not have blurry vision. Sepia also came up, but sepia is not submissive and it did not act on diplopia. Lycopodium also came up in the chart, but Lycopodium did not support the physical complaints as well. Embarrassment is not the etiology of Lycopodium. There is a typical symptom in this case which attracted my attention towards Gelsemium was headache due to holding urine. Else, it covered the physical symptoms related to head and vision. That's why on the totality and the personality, the submissive personality, that's why I chose Gelsemium in this case. We need a remedy which should be the mirror image of patient when we prefer constitutional approach to enter in the case. What are the other approaches to enter in the case? Yes, anyone? How do we enter in any case?
Shruti is writing PQRS.
PQRS, very good. At least she answered. Thank you, Shruti. And if
Shreya
you
also writing PQRS.
don't write the same thing, thank you. But the other one, you know,
Samina is writing concomitant. Someone is writing dream, hobby,
hmm,
totality, keynote.
constitutional means totality running. Keynote means PQRS. Already done. You know, we usually enter in the cases either through constitutional approach or through PQRS, of course. And the third is essence of the remedy. Like the essence of Barata Karbi shyness, hiding himself behind the mother. So we have essence, we have the core of the remedies, and from that core we enter in the cases. For example, the core of status agree is give respect and take respect. So like that, if you know the core of the remedies, the essence of the remedies, it is really easy to handle the patient. Now, Gelsemium people are basically gentle, sensitive, and vulnerable. The opinion of others is important to them, and they are therefore careful in how they approach people. You know, there is a proverb in Hindi, सबसे बड़ा रोग क्या कहेंगे लोग. This is the core of the Gelsemium. They always worried about others' opinion. They can feel like a soldier on front line, outwardly having to remain staunch, but inwardly afraid of everything around them. They expect peace and harmony, hence any bad news or sensitive sin make them vulnerable. They feel better after crying. Crying amelioration is there in Gelsemium. Now my question is that why 200 CH? It should be your question, not my question. Why I chose 200? Do you know how we select potencies?
Emotional manifestations are important
If
at
you
mind level.
Okay, then it is said that at mind level we usually select high potencies, 1 m, 10 m like that. Then why 200?
Chronicity, someone has written.
Autism is usually a chronic disease which I am handling more, but I am using 10 m in the beginning, not 200.
Susceptibility of the patient.
Hmm. It is a good input and simple answer. Don't make it complicated. So these are the basic things which you should know. Why 200 potency is there? 200 CH is medium high potency. We call 30, 3C, 6C, 12C, and 30 as the mild potencies, and 200 is a medium high potency. Addresses emotional and physical plane equally. It is safe and recommended in sensitive patients, and that's why I use 200 potency here. Now see the follow-up after a month. He said, I have 95% improvement in vision. It is almost clear. I can see an object without double image. Last time when I came here, I used to wear prism glasses, which I am not using now at all. Without prism specs, even I have fine vision. It is like a miracle. I have been advised surgery, but thanks to you and homeopathy, my vision is back. I do not have any more headache. My blood pressure is normal. I first went for other medication. If I would have consulted you earlier, my vision might have cleared faster. See and meet the patient.
भैया नमस्ते।
जी
आप
नमस्ते।
जैसे मेरे पास में आए थे 26 अक्टूबर 2022 को, है ना?
जी
तो एग्जैक्ट क्या प्रॉब्लम हो रहा था?
उस समय मुझे ना डबल विजन दिखता था। मतलब विथ माय ओपन टू आईज आई कुड नॉट सी द इमेज और ऑब्जेक्ट्स क्लियरली। दो इमेज दिखता था। अगर एक आंख से दिखता था तो क्लियर दिखता था उसका।
अच्छा।
तो स्कैन वगैरह किया था तो उसमें ये दिखा था कि राइट नाउ रेक्टर पॉलिसी है करके।
अच्छा, वो आपको बताया था। हाँ, 6 नर्व रेक्टस पाल्सी बराबर है। अभी मुझे बताइए, ये जो था डायग्नोसिस आपका, वो था हॉरिजॉन्टल डिप्लोपिया,
जी
बराबर है?
हॉरिजॉन्टल था, यानी ऑब्जेक्ट जो दिखते थे तो समझ लीजिए ये एक है तो उसके बाजू में दूसरा दिखता था।
हाँ,
ऐसा नहीं दिखता था, ऐसा दिखता था।
हाँ, ये दिखता था। अभी अपन ने दवाई शुरू किया और मेरे 26 अक्टूबर 2022 को, और आपको मेरे पास में अभी समझो 1 महीना हो गया, आज 28 हो गया, है ना? तो आपको क्या फर्क पड़ा ये 1 महीने में?
ये 1 महीने में मुझे ना मतलब विजन जो है वो ऑलमोस्ट क्लियर हो गया है। नाउ वी कैन से लाइक अप टू 95% आई एम व्यूइंग द ऑब्जेक्ट्स एंड विद क्लियर वन।
Means now you are able to see one image. अभी आपको मैं एक ही दिख रही हूँ कि दो दिख रही हूँ?
अभी वन दिख रहा। लास्ट टाइम मैं आया था आपके पास तो with my specs I came here. That is called prism glasses.
Yes.
But now I am not using that prism glasses in my daily activity, and that is keeping in my somewhere near to me.
Okay.
But I am not using that glasses.
Okay.
तो without that specs also मैं अच्छे से देख सकता हूँ। और ये सब आपके ही वजह से हो सका है।
क्या शब्द देंगे इसको हम?
It's like a miracle.
Thank you so much.
Yes.
Thank you so much. Homeopathy works actually. But कैसा है कि थोड़ा सा आप और लेट हो गए मेरे पास आने में, थोड़ा जल्दी आते।
हाँ यस मैम, लेट भी हो गया। और सम टाइम आई फील कि एलोपैथिक अच्छा है, ये है, लेकिन
दैट इज ओके। वो सबको लगता है, शुरू में सब वही जाते हैं और फिर हमारे पास जब आते तो केस बहुत कॉम्प्लिकेटेड रहता है। बट इट्स ओके, नो प्रॉब्लम। थैंक यू।
You see, every science has some limitation and some scope. So whenever we ended up or we give up, allopathy supports us. And whenever they are ending up or they are giving up, we are there to support them. So in Europe or in other countries, we are handling our patients in an integrative way, because patients who are admitted in the hospital, even in India, who are admitted in the hospital, for example, if I'm handling a case of coma, so I cannot tell them that remove your patient from the ICU and I'll take the whole responsibility. So in such cases, sometimes we have to enter with the integrative approach also. So this is the new and actually required approach nowadays. But if you are working with homeopathy solely, still you can creating the miracle because homeopathy has that ability. Six nerve palsy includes this treatment includes antibiotics, surgery, lumbar puncture, chemotherapy, and other cancer treatments like prism therapy and injections and strabismus surgery. Homeopathy treated it in a classical way by matching core of the person and core of remedy within a month. So I even did not touch the patient, still I could create the changes in his body. And the one more important thing is that my myth about gelsemium, covering only muscular weakness and its famous 3Ds like dizziness, drowsiness, and dullness, and examination funk got crushed. I understood that gelsemium can work beyond this also because sometimes we get prejudiced even with the remedy. As already Hanuman mentioned in aphorism 183 that one should not be prejudiced with remedies too. But sometimes we get prejudiced that if there is dip in disposition, she must be pulsatilla. If there is 3D, it must be gelsemium. It's not like that. Let me share you one clinical experience. I have treated a case of paranoid schizophrenia. He was a boy of 14 years and I treated the case successfully and you will be amazed to know the name of the remedy. I treated the case with the remedy Drosera. And before this case, I knew Drosera only for the upper respiratory tract infection, the typical dry cough. Patient needs support while coughing, keeping his hands on his chest like that. So whatever we are reading in the books, homeopathy is much, much, much bigger and beyond the horizon than that. So please try to understand homeopathy in the depth. This case taught me key to success, that is Organon to Materia Medica by proving the meaning of never be prejudiced to any remedy. And thanks to Organon for that. I am not done here, shall continue his treatment to address the underlying cause hypertension. After that also he used to came my place for hypertension and now he is really doing well. Now let us discuss today's third case, that is chronic inflammation of mandibular temporal joint, headache, acidity and bronchitis treated with homeopathy in just 2 months. A 60-year male visited me in August 2023 for extreme pain in left empty joint, mandibular temporal joint here, since 5 years, which got intolerable since last 11 months from September 2022. He said, I am not able to chew as I could not open mouth, eating impossible. I underwent different medication for the same, but no relief at all. I took steroids. My doctor suggested me liquid diet for 6 months. I followed him religiously, like an infant diet, just liquid, nothing else. Now I fed up with this pain and liquid diet making me weak. I suffer from headache once in a month since long time. For that, I am taking painkillers. It aggravates if hunger is not satisfied and sleep is inadequate. 6 months back, I had thyroiditis as said by his physician, as well bronchitis. For that, they nebulized me. I am having acidity, loose motion, cough, and lack of sleep since a week. Generally, my sleep is good, but a slight noise can disturb it. I get soreness in throat after banana. My leg pain after playing badminton. By nature, I am a cool person, having lot of patience. I am always optimistic, but due to this pain, I am scared now. I feel I will die. Pain is intolerable, and how long will I survive on liquid diet now? This is his major concern that I don't want to continue the liquid diet, and you please reduce this pain. I am a contented person, he said. My business is settled, no trouble in family and life. God has given me everything. I'm blessed. I tell my wife that once I get relief from the pain, I will be again the happiest person in the world. Personal history, typhoid and jaundice 12 years back, root canal 4 times, first happened at the age of 15. And family history, father was diabetic. Now analysis. Empty joint or the temporomandibular joint, TMJ, is formed by the articulation of the mandible and the temporal bone of the cranium. It is located anteriorly to the tragus of the ear on the lateral aspect of the face. It acts like a sliding hinge connecting jawbone to skull. Temporomandibular joint dysfunction causes pain and restriction in movement of the jaw, joint, and surrounding muscle. Difficult chewing, clicking, and locking of the jaw joint is there. I was enjoying his interview. You know, when patient talks, sometimes we really feel happy or cheerful with few patient because of their aura. I was enjoying his interview. Although he was in great pain, I could observe a very innocent laugh, cheerfulness, and bubbly talk. Laughing was also painful for him as there was swelling in TMJ. Was this optimism in spite of weakness or his basic behavior? Actually, when you see such patient, you always have one question in your mind: is he really that much optimistic, or it is the basic nature of the patient? If this is the optimism in spite of weakness, then there is one remedy in homeopathy for this characteristic rubric. Now, this is the time you will answer me. Which is the remedy which has optimism in spite of weakness?
Shruti writes Ignatia.
Okay.
Parul writes Carcinosin.
Hmm.
Lauren writes
Hmm.
Arnicite.
Okay. Anybody else? We have around 52 participants.
Someone is writing Carcinosin again.
Hmm.
Shama is writing sulfur. Suresh writes phosphorus.
Could you please think out of the box?
Chris writes tuberculinum.
Why tuberculinum?
You can unmute yourself and answer the question. Someone is writing coffea, sanguinaria.
Hmm. For this rubric, optimism in spite of weakness.
Stramonium.
Now, thank you all for putting your efforts. I congratulate you, but all are wrong. You know, for optimism in spite of weakness, we have only one remedy mentioned in repertory, that is Falcon Pergerinus. You know, Falcon Per. It's a bird remedy. बाज इन हिंदी we call it as a बाज. बाज होता है ना जो उड़ता है, बड़े बड़े पंख होते हैं. So this remedy is falcon per, and falcon per is a bird remedy. Falcons has such a strong leg that they can flew 600 kilometers in one go above the sea. So I was thinking about his behavior, whether it is nature or should I consider this rubric. If I would have considered only this rubric, I might have prescribed him falcon per. This patient is not sounding like falcon per. There was no cheerfulness alternating with pain. Otherwise, I might have thought about platina. Platina has this typical characteristic rubric, cheerfulness alternating with the pain. What could be the other remedy covering such jolly behavior? Yes? Now the question is changed. You can answer.
Can you repeat the question?
Yes.
Ignatia, someone has written. Manpreet has written Ignatia.
My question is that what could be the other remedy covering such a jolly, cheerful behavior? If it is not falcon tea, if it is not platina, then which remedy is this?
Ruta, Harinath is writing.
Ruta. Is Ruta very jolly, cheerful, happy, easygoing person? I doubt.
Manpreet writes Belladonna, Phosphorus Belladonna.
Hmm. Phosphorus is harmonious, promiscuous, cheerful, mixing with people, but he is not basically jolly or cheerful.
Samina wants to speak. Samina, you can unmute yourself and speak.
Yeah,
Yes.
yeah. Good afternoon, ma'am.
Good afternoon, Samina. How are you?
Yeah, from the case, I have a doubt. Yeah, I'm fine. Thank you. Yeah, interesting cases. Yeah, so in this, as I was listening, the last he one line was there, na, you'll die of the pain.
Yes.
Yeah, so that's why I don't know how he's optimistic just from his behavior, from his laughing, because he used that word, right, that I'll die. So that is an pessimistic attitude, right? Yeah.
He used this word with laughing. I feel, doctor, that I will die with this pen. Like that. Because he used this sentence to
Okay, so he was like a
explain
joke. Yeah,
the
jesting.
not a joke. He explained his word. He used this word to explain the intensity of the pain. You know, sometimes we tell or patient tells us, डॉक्टर इतना दर्द है कि मैं मर जाऊंगी, आप कुछ दीजिए. उससे पेशेंट मर जाएगा या ऑप्टिमिस्टिक साउंड नहीं होता बेटा.
Okay.
We cannot consider the
Okay,
patient
so the
as a
way he said.
pessimist. The way he talks, so that you can understand the intensity of the pain. Because you know, in homeopathy, when patient come to our place, he actually tried everything, all the school, and when he develops resistance to their remedies or he didn't get something fruitful over there, then only they land in our airport, and we always get complicated cases.
Yeah.
Understood? So, what
Okay.
is the
So,
remedy, Samina?
yeah. So, yeah, optimism in spite of weakness and complete. There are two remedies, Kali Carb and Gallium
Samina, I guess
apparent, which you're saying.
for optimism in spite of weakness, if you see in the mental chapter, it is falcon peak, bird remedy.
In mind only, I'm seeing of weakness. It's Kali Carb and Gallium,
Which
that which
rubric you are
one said.
reading,
Yeah,
Samina?
this two I cannot see which you're saying. Sorry.
Samina, which rubric?
In mind only, optimism in spite of weakness.
Which repertory you are using?
Optimism in spite of weakness. Yeah, two
Okay.
remedies. Complete repertory.
Complete. Okay. I don't use complete repertory. It is given in the falcon P is only mentioned in synthesis 9 treasure edition. But still,
Oh,
thank you for your input. But these two remedies are also not here in this case.
okay.
And that was we were discussing in the last slide. Now my question is different, Samina. The question I asked is that if it is not falcon P, if it is not platina, because in platina we have the characteristic rubric cheerfulness alternating with pain. प्लैटिना को पेन होता थोड़ी देर से हैप्पी रहता फिर पेन होता फिर हैप्पी रहता सो आई एम नॉट आस्किंग अबाउट दैट नाउ माय क्वेश्चन इज डिफरेंट my question is that if it is not falcon tea, if it is not platina, then which remedy could be the other remedy covering such jolly behavior?
Okay, no idea.
You can try. I guess you know.
Okay.
अगर कोई नहीं बोलेगा तो मैं बोलते आगे. Should I continue?
Yes, yes.
Okay. It is an interesting thing about our biochemistry that love, sex, pain, and violence all stimulate the release of similar chemicals and hormones. You see, dopamine is responsible for the pain, but at the same time, dopamine provides you pleasure in the sex and food. So it is interesting thing in our biochemistry that love, sex, pain, and violence all stimulate the release of similar chemicals and hormones. Endorphins that a response to pain may create pleasure. For example, like I just told you about dopamine. Serotonin is one more neurotransmitter. Serotonin and melatonin may be produced by stress and transform pain into pleasure. There is a complex relationship in the body between the perception of pleasurable and painful events. And there is one important remedy which matches to this cycle, how the pain gets reduced or how the pain joy gets increased with the same remedy. And this remedy is coffee cruda. Coffea cruda's most peculiar aspect seems to match this interesting biochemical oddity in the body. So my prescription in this case was coffea cruda. Somebody answered coffea cruda for the previous rubric, but the person did not answer coffea cruda for this remedy. For the next question. Otherwise, आपका आंसर सही रहता. Coffea covered the following rubric: elements from excessive laughing, elements from unhappiness, elements from excessive joy, blissful feeling, cheerful, sadness alternating with cheerfulness, beautiful landscape, delusion of beautiful landscape, eccentricity, fear death of, impressionable to pleasure, laughing, loquacity, sensitive to all external impressions, and witty. And few highlight symptoms of coffee remedy is pain is intolerable. It is the main remedy for that. Despair with the pain. You know, patient when saying you, doctor, I will die with this pain. मर जाऊंगा यार मैं इस दर्द से. It means this is this way of explaining the intensity, and he is explaining his despairness with the despairment with the pain. Fear of death from pain, moaning from pain, shrieking with pain, and unendurable sensitiveness to the pain is present in coffea. In coffea, the reaction to pleasure is extreme and exaggerated. So is the reaction to pain. They react to everything in high intensity. Their intensity, like lachesis has a very strong sexual drive, intense sexual drive. Like coffea's reactions to pleasure and to pain are extreme. Coffea cannot control their sensitivity, cannot bear how things make them feel. It covers neuralgic pain. Coffea is the single remedy which covers face pain or tooth pain or inflammation of the uterus from excessive joy. Tooth pain, face pain from excessive joy, inflammation of the uterus from excessive joy, sleeplessness from surprising news. Doesn't matter whether the news is good or bad. If it is bad, gentleman will feel hurt. Phosphorus may feel bad. But if the news is good, still coffea will become sleepless. And sleeplessness from surprising news and impressionable to pleasure. Usually we see impressionable to bad news, phosphorus is there. And impressionable to pleasure, coffea is there. I was talking to a person who is so sensitive that exciting joyous state of mind made him sick, as per my observation. Who is afraid of suffering, sensitive to pain, who in fact feels pain from things that shouldn't cause it. There is an overreaction in coffea and oversensitivity of those processes which provoke the hormone relating to pleasure. It is as if the person cannot bear the idea of pain and must transform it into pleasure as quickly as possible. They cannot tolerate the pain. They all the time want fun, pleasure. They want to do something just because they want to run away from the pain, because there is endurability to the pain. The sensitivity to pleasure and the sensitive to pain are on an axis for this remedy, two ends of one problem. Coffee wishes to feel only pleasure, not pain, or to transform the pains of the world into the pleasure of the heaven. Coffee patients are not just worried about physical pain. You can see fear of hearing bad news as well as fear of impending danger and ailments from surprises are the rubrics under the remedy coffea. Now follow up after 15 days. When I gave him coffea cruda 200 on single dose, the follow up is chief complaint was severe pain, difficulty in eating, pain referred to head and teeth, panic due to pain, and literally he did not want to continue my treatment because he came with high expectation towards me and he didn't get anything. I just gave him placebo. Coffea is a deep remedy, so thought to wait little more. It has provoked sora, hence pains were coming out. And you see, after our medication, if the pains are getting little aggravated, that is a good sign for us. So it is the time where we need to counsel the patient that anyhow he should be continue with you. Now listen him after a month.
नमस्ते।
नमस्ते
अपन 23 अगस्त को मिले थे।
जी।
उस समय आप किस चीज के लिए मेरे पास आए थे?
मुझे टीएमजे का प्रॉब्लम था।
हाँ।
और मुझे खाना खाते समय काफी दर्द होता था, एक्सट्रीम दर्द होता था
जी।
तो मैं 23 तारीख को आपके पास आया
जी।
आपने मुझे दवाई दी। उसके बाद 1 महीने में मुझे करीब करीब 70% से ऊपर फर्क पड़ गया है।
अभी आप खाना खा पा रहे हैं?
अभी आराम से खाना खा पा रहा हूँ।
इसके पहले आपने एलोपैथी ली होंगे ना भी इसके लिए?
हाँ, एलोपैथी ली मैंने। यहाँ पे इंजेक्शंस भी लगवाए थे गाल के अंदर,
स्टेरॉइड के।
हाँ, स्टेरॉइड्स या मुझे मालूम नहीं कैसे थे।
ओके, पर उससे क्या फर्क पड़ा था अपने को?
उससे महीना 2 महीना ठीक रहा।
हाँ।
उसके बाद फिर से दर्द उठ गया। उन्होंने मुझे बोला था कि सिर्फ लिक्विड डाइट पे रहो।
अच्छा।
कोई भी सॉलिड चीज नहीं खाना।
जिंदगी भर?
नहीं, कम से कम 6 महीना टोटल लिक्विड डाइट पे। मतलब जो 6 महीने का बच्चा रहता है वैसे रहो।
तो हमने आपको कोई डाइट के रिस्ट्रिक्शन दिया?
आपने तो सब चीजें खाने को बोले और उसके बाद काफी फर्क पड़ गया। मतलब मैं आराम से कुछ भी खा लेता हूँ। अच्छा, और जो महीने में एक बार सिर दर्द आ रहा था वो कैसा है? अभी नहीं, अभी तो कोई बीमारी उसके बाद आपकी दवाई के बाद अभी कोई ना पेट दर्द ये वो कुछ भी नहीं, कोई तकलीफ। और वो जो अपने को एक ब्रोंकाइटिस का 6 महीने पहले प्रॉब्लम आया था, उसके बाद थायराइडाइटिस आया था, अभी कुछ भी नहीं, एब्सोल्युटली नॉर्मल है, एब्सोल्युटली नॉर्मल। मतलब 6 महीने मुझे यहाँ से यहाँ तक काफी प्रॉब्लम रही हर चीज की। अभी तो कुछ भी नहीं है। तो 1 महीने में होम्योपैथी दवाई से कितना % फर्क पड़ा? 70% से ऊपर फर्क पड़ा। जी, चलिए, धन्यवाद। धन्यवाद।
You see, did you observe? He pressed the word काफी आराम आया. Coffee created काफी आराम. Good. Now follow up after 2 months. He came with his wife as a new patient. This is the benefit of homeopathy. She said, "I'm so impressed with your treatment. What did you give him?" I could not believe that homeopathy relieved the patient where steroid could not help. I saw him suffering for years and you relieved him within a month. It is like a miracle for us. I explained her about homeopathy, its sources and mode of action. Sometimes we should spare a little time from our busy practice to clear the myths of society about homeopathy. Because usually they feel that it is a long-term therapy, it doesn't work in acute cases. And what will it do when the case is long, patient is suffering from 2 or 3 years, and when steroid is not able to provide any relief, what the homeopathy is going to do? It helps in healthy growth of homeopaths as well as homeopathy. So in this case, this time I just give the placebo and nothing. Now follow up after 3 months.
भैया अभी अपने को दवाई शुरू करके लगभग ना अपन ने अगस्त में शुरू किया था, तो अभी तो नवंबर चल रहा है, तो एक 3-4 महीने तो हो ही गए। हाँ। अभी पेन कैसा है?
बिल्कुल भी नहीं
है। भूल तो नहीं गया आप पेन को?
भूल ही गया, ये समझ लीजिए।
अच्छा, चलो बहुत ही बढ़िया है। और दूसरे बाकी जो सिम्टम थे, कभी कभी हेडेक, ब्रोंकाइटिस।
हेडेक मुझे ये समझ लो 4 महीने में सिर्फ एक बार अभी लास्ट संडे आया।
उसकी वजह?
वो भी शायद मैं मैच देख रहा था, वो टेंशन वगैरह के कारण आया।
अच्छा, तो मैच ना देखिए।
हाँ।
कल के बाद नहीं आया टेंशन? इंडिया
देखेंगे मैच।
No pain, no complaint. He said, "I'm going on vacation. Just wondering if I get pain there, what will I do?" I gave him placebo as a SOS dose. I gave him regular remedy and made placebo in one bottle and told him that whenever you feel any type of pain in your PMJ, take 4 pills from this bottle. Now let me explain you what is placebo. But before that, I would like to listen from you what is placebo. Yes, anyone?
When the deep acting remedy is acting and the patient is not likely to get the feel that in the absence of remedy that he will get improvement. Medication is taken and it will act.
Okay, thank you so much. Anybody else?
Dr. Shruti writes psychological treatment
It's not
for
psychological.
mental relaxation to boost improvement.
Shruti, I understood your meaning. Your answer is correct. But compile in correct words. You know, placebo.
Unmedicated pills, madam. Unmedicated pills.
It is not unmedicated pill. It is medicated with your trust. Isn't it? Placebo is not a plain remedy. They are not plain globules. It is the dynamic bond between the trust of the patient and the knowledge of the physician. Because patient trusts that you have given him something. The medicine doesn't matter. Your confidence matters. Understand? So placebo is your confidence. It is the reflection of your confidence and the trust of the patient. Now follow up after 4 months. Listen to him again.
ये अभी अपन को ट्रीटमेंट शुरू करके लगभग आपका शुरू किया था 23 अगस्त को, है ना? अभी दिसंबर चल रहा है, तो आप अभी बनारस भी जाके 15 दिन घूम के आए?
बहुत आराम से घूम
तो
के आया, कहीं कोई प्रॉब्लम नहीं
डॉक्टर भी किया था हमने। अच्छा, तो कोई तकलीफ नहीं है?
कोई तकलीफ नहीं, इतनी ठंडी में भी कहीं पे भी कोई प्रॉब्लम नहीं।
कोई कान का दर्द थी?
कुछ भी नहीं, जो सिर में आता था, कान में आता था, यहाँ आता था, कहीं कोई दर्द नहीं।
महीने में एक बार जल्दी ठीक हुआ। और महीने में एक बार वाला जो हेडेक था
वो भी नहीं आता। अब सिर दर्द नहीं होता है।
मैच नहीं देख रहे अभी? हाँ, मैच नहीं देख रहे। मैच नहीं देखता। चलो बढ़िया।
आज भी नहीं देखता वो।
चलो, अभी आप 23 अगस्त से लेके आज तक के अगर हम काउंट करें परसेंटेज वाइज तो कितना परसेंट है?
अभी तो पूरा ही हो गया मुझे। 2 महीने से कोई प्रॉब्लम नहीं है।
बढ़िया,
कोई प्रॉब्लम नहीं है।
चलो गुड, थैंक यू सो मच फॉर ट्रस्टिंग इन होम्योपैथी।
बहुत जल्दी ठीक हो गई।
आपने ठीक किया, नहीं तो मुझे
साल से घूम रहे थे, ठीक ही नहीं हुआ, यहाँ जाकर ठीक हो गया, बहुत जल्दी ठीक हो गया।
गॉड ब्लेस।
Patient satisfaction is very important. Homeopathy is not a slow or long-term therapy. If appropriate medicine selected from knowledge of Materia Medica, proper rubrics from repertory, and the strategy of repeating doses from organ. You see, recently I treated a case of cerebral palsy. He was my CA, around 37 years old patient, and I presented this case in Bogota in the World Congress of Homeopathy. Recently happened in October 2023 in Colombia. I was there as an invited keynote speaker. So I delivered 2 sessions, one about autism. I launched my new method, 4C method about autism, and second paper I presented about the cerebral palsy. Cerebral palsy patient suffered from blur vision. There is streaking atrophy of his brain. There was degenerative and fatty infiltration in the liver, degeneration in the urinary bladder, and as well as degeneration in the spine. So for me, degeneration was the keynote everywhere. He was not able to walk without any support. He was not able to see the things because the vision became blurred and speech became fumbled. His speech was not good when he met me. I treated him in just 6 months with the remedy Wi-Fi radiation. I gave him Wi-Fi radiation remedy, 10 power, and I treated him. I did not treat the atrophy of brain because atrophy is some irreversible change. But yes, I stopped his degeneration, and along with that, he had annular tear also in the spine. I have all the videos and evidences before and after test and everything. So who says that we cannot change the picture? He is able to write everything. He is able to talk fluently. There is no fumbling at all, and his vision is totally clear, better than me even. So, homeopathy is actually not a long-term or slow therapy. But unfortunately, few doctors, few homeopaths are giving this information to the patient. Because in my practice, I usually get patient and they say that doctor, before we went to that XYZ doctor and he said, I'll require 2 years. I took his medicine for 4 years for psoriasis. And he said, this is homeopathy. It works slowly. You have to keep patient. Doctors just bargain their time because they are not able to find out appropriate remedy. Please don't do that because I am treating psoriatic cases or eczema in just 1 year. You can also do that. So please don't spoil the image of homeopathy because of lack of knowledge on your side. Try to understand, try to learn and read more. Okay? And please do not forget to read the below aphorism. If you really want to the keynote or the success in homeopathy, the success in dealing chronic cases in quick time. So secret is hidden in the organ. Now you will answer me. Mode of employing remedies in chronic diseases present in which aphorism? Or repetition of doses, how to increase the power of medicine, repetition of medicine in the same potency, and never be prejudiced to any remedy. All these things are already mentioned in Organon. We are not doing anything new. But you have to answer me the aphorism. Because we are learning Organon for many years. In India, at least, we are learning Organon for 5 years, 6 years. Yes, Takshi, मैंने answer?
Yes, ma'am. Manpreet has answered.
Hmm?
246 to 251.
246 to 251. Okay. Anybody else?
$185. Samina is answering.
Okay. Manpreet, tell me one thing. What is mentioned in which aphorism? Mode of employing medicines in chronic diseases is mentioned in which aphorism?
You can
Ma'am,
unmute and answer.
in aphorism 245 to 251 about repetition of doses is given. That's about in all kinds of cases.
Okay. Thank you, Manpreet. I am really happy that at least on this last slide, somebody answered correct. But only your answer is little partial, but that is okay. 10% discount. Write down the aphorisms, my dear friends. Mode of employing remedies in chronic diseases is mentioned in the aphorism 246. Repetition of dose is mentioned in aphorism 247. How to increase the power of medicine is mentioned in aphorism 248. Repetition of medicine in the same potency is mentioned in aphorism 251. And never be prejudiced to any remedy is mentioned in aphorism 258. Right? So these aphorisms are really helpful in the practice. And without Organon, we cannot provide permanent results. Without Organon, you are not going to touch the miasm of the patient. And without Organon, you are not going to select the appropriate remedy. So please try to select the appropriate remedy with the help of Organon and try to enter in your patient from Organon to Materia Medica. So this is all about today's session. And this is my book which published last year, available on BGen, Healing Woman with Homeopathy. And thank you so much for your patience listening. I guess I took 16 minutes extra. It was a 1 hour session. I think I took 1 hour and 20 minutes. I'm sorry for that. But if you have any questions, please ask me. I'm here to answer you.
Ma'am, there are 2-3 questions.
Yes, Peter, please ask me. Can I stop sharing my screen?
Yes, yes.
Thank you.
I'll quickly take the questions of the chat box. Then if anyone have any question, they can unmute themselves.
Yes.
First, I'll take the chat box question.
Okay.
So,
can I read the chat? Okay.
So Manula is asking, how is your approach in regards with heavy metals intoxication?
Manula, If I say this answer, please do not follow in your practice, because go with your individual thought and decide according to your patient. But she asked my approach. So my approach is usually I use nozo to clean the toxin in hypotensive. Any other question?
There's a question. What do you think about the miasmatic block of cure or allopathy block or block created by exogenous toxin substances or heavy metals? I think it's been answered.
Mihila Zizi, okay. What do you think about the miasmatic block of cure or allopathic block or block created by the She's asking about the miasm basically. I don't think anything about it, but I just try to clear it with my cleansing method. You see, usually I approach, or my approach in handling cases is 4C. First cleansing, then constitutional, then complementary remedy, and then clinical remedy. So I first take the case and I see what is the miasm in that particular case. Is it coming from the fetalhood of the child, from the pregnancy time of the mother, or it is some material toxin like vaccination? So if it is vaccination, then I choose the remedy according to this. But remember one thing, in such cases, when you are going to remove the miasm, your medicine, especially if you are handling psychiatric disorder, must be the mirror image of the child's current symptom to the mother's pregnancy mental status. They should match like a mirror image. Then you can go with that remedy. This is my approach.
Ma'am, Gunjan is asking, hello ma'am, what potency should be selected in acutes for kids?
Gunjan, you know, kids have very good susceptibility. And if the stage is acute, usually I prefer high potency. They react fast because 30 and 200 doesn't work for them if they are quite good, and their susceptibility is also good, so you can go ahead. Yes, Gunjan, unmute yourself. Gunjan, we can't hear you.
Yes, hello, ma'am. Yeah,
Hi.
hello, ma'am. In some kids, I tried it, but their sensitivity is too, like the vital force, maybe the sensitivity. So when I have tried 200 now, what happen is they get, sometimes it works on several kids, and in some kids it won't work. Like they get some other symptoms or
Hi.
some weakness kind of
Hi.
thing.
Because you didn't follow the individuality. You know,
Okay.
your question itself is a question in a frame. Actually, I wanted to answer you that go with individuality, but I
Yeah.
answered you for acute and kid, but you didn't
Yeah.
follow the individuality. You see, every case is a new case. Hanuman mentioned in aphorism 83. So you
Yes.
cannot apply one logic to the other patient. If
Yes.
you
Yes.
give one and got good results with 1M or 10M in one patient, it is not the rule that you are going to get good results in same
No,
potency in
what
other patient.
problem has occurred, madam? When in some kids, na, the sensitivity is very, the kids are very sensitive, but the disease fear is very fast, right? So we need to match to the disease fear also. But what
Exactly.
happen is their sensitivity is low. So if I'll give little higher potency, the kids is they are not able to tolerate it. So
So what to
in
do
that,
now?
so repeat the 30 low potency repetition should be more.
For example, if you are getting good result in 200, but you feel that I want to put 1M for better result, and the child is not able to handle 1M, not able to bear 1M. But if you want to shake the vitality again and again, and you want the result of 1M in 200 potency, then what to do, Gunjan?
Well, I generally do in water doses. I give the medicine in water
Exactly.
doses.
So
Yes.
use aqua remedies and give the frequent doses. For example, you
Yeah,
can
I
give
have done,
300.
madam, but still
Yeah.
the kids are sensitive. In some cases, I told you, na, in some cases, I generally give this potential only, but they are sensitive, but the
If they
disease
are
fear.
sensitive, Gunjan, there is one more option. The option
Hmm.
is that in water potency or aqua potency, if you are using 200, we usually put the remedy 200 potency in 1 cup of
Yes.
water, and
Yes.
we take and repeat that. But if
Yes.
you really feel that the child is too much sensitive, even for
Hmm.
200, but you are very sure that 200 will create the changes, then the way is that give in the plusing method, give in the 5 cup method, diluted method. So
Yes.
take 6, 7 cups, not only 5 cups, go for 10 cups. And then you can give whatever potency you want. Just put 1 drop of remedy in first cup, stir it well, and take
Yes.
the 1 drop from that cup and put it in the another. Stir it well, take 1 drop and put it in the third cup. Do this till 10 cup, and the last 10th cup is your remedy. So you will be able to use the potency whatever you are desiring without any medicinal or homeopathic aggravation. Hahnemann has given every option in Organon.
Yeah, but madam, I'm new. I was new, but now practically I am practicing and I'm finding it very, very, very
Exactly,
effective.
exactly.
And
Yes.
it works very nice in acute and chronic, and patients are better in few minutes. It is like that.
Exactly.
But,
You know,
but
because
still, I am.
Organon, yeah, yes, please continue.
And I like to share you one very beautiful experience. I follow your autism this thing on YouTube, and I have treated several cases, but I have not used till no source because I don't have that much courage. But
Okay.
yeah, I got a little idea. I'm working. I'm studying also simultaneously on the both the things. But still, I generally I need that courage to put
Exactly.
no source.
See, Gunjan, please take your time because using nosode is really difficult. And I
Yes,
studied nosodes for 12 years. I studied
yes, madam.
psychiatry. Right now, I am practicing since 24 years. But I
Yeah.
studied psychiatry and nosodes and special all these disorders, psychiatric disorders,
Even
like
I
schizophrenia and everything for 12 years. In last
yes,
12 years, I am studying psychiatry like anything, and that's why now I am sure, short, and very much confident that this remedy works like that, and I can handle, I can give the results in schizophrenia and autism and everywhere. But for that, I dedicated my 12 years. So please take
yes,
your time.
yes,
Don't
madam.
rush.
Since 4 to 5 years, I'm working very hard on these things. I have called up you like in between also, but in autism cases, like it helped me a lot. At least it has given me idea. I'm working, and
I'm
even I
glad that
want.
I can show you path. Thank you so
And
much.
even one most good experience I'll share you. Even I am Jain, and I told this thing ki how the lead poisoning and the iron, like this mercury, is affecting. So please be aware. At least the next generation, it will not suffer with that much. People are not aware. So we have took that workshop in our towns, and yeah, it is helping, and thanks to you, ma'am, for that.
You're most welcome, dear.
Yes, yes.
Madam, I have a question. Based on inputs from mother over WhatsApp and phone calls, I started treating a girl child of 11 years.
Okay.
The first prescription itself, based on plant sensitivity, I chose one remedy, and within 1 week, with daily 1 dose of only 30 C potency, mother says that emotional level it has given lot of improvement, but the physical problem like itching
Mm-hmm.
has not shown any signs of diminishing. So now shall I go from 30 to 1 M kind of potency,
No, no,
because
no,
it's very
doctor.
clear.
No,
Hmm.
doctor. Your potency is really working very good, and itching is a good sign. Sora is coming out. It is the
Yeah,
beginning of Sora. So why do you want to suppress it? Just suggest her to apply olive oil 4 to 5 times per day. That's all.
and continue with 30 potency for a little longer.
Yes, exactly. Because it is
Thank
actually
you.
it is the suitable potency for the child's vitality, and it is shaking the vitality. Good
Yeah,
vibration. So don't change it.
thank you. Thank you very much.
Welcome.
Ma'am, many of them are asking about your book,
This book is
the name
already
of the book.
present on the name of the book is Healing Woman with Homeopathy. I'll show you again. This is the book Healing Woman with Homeopathy. I have lot of books. You can visit my website and you will get all these psychiatric books on my website. You have to download it from Amazon. It is present on Amazon, but only this book is present even on Bijan's website. If you will put Healing Woman with Homeopathy by Dr. Kavita Chandak, you will get the link.
People are also asking about any other recommendation of Materia Medica, any book that they can refer.
There are thousands of books they can refer, but what I am reading, I will share with you. I usually read Vermilion Prisma, Harrington. These are my favorite books. Sometimes I do read Borland also. I have lot of Materia Medica, like Julian's Materia Medica, Margaret Tyler's Materia Medica. So I am reading lot of books, but one of my favorite is Harrington and Vermilion Prisma, because Vermilion usually talks about pathology, from where it originates.
Ma'am, in all the cases, there were single, Pokia cases. So it was
Samina,
one
I
dose.
can't hear you. I can't hear you, Samina. Could you please repeat your question?
Yeah.
Mhm.
Yes. No, in gel. So the repetition was how many doses
As
did
per
you
the,
give to?
as per the need,
Because they're really good. Yeah.
Samina, as per the need of the case, but usually if patient is visiting me for 1 year, say, for example, I give only 2 or 3 doses throughout 1 year. That's all. One is dry dose, which I usually prefer first one, and second I give the same remedy with same potency in aqua. But if I need, I increase the potency. And apart from that, I usually use intercurrent remedies to boost up the action of the main remedy. But I do not usually change the main remedy because I'm usually firm with my remedies, so I don't change them.
Okay. So you basically which repertory you use? Synthetic, not complete repertoire.
Synthesis treasure edition, synthesis 9 treasure edition.
Okay. Because yeah, I saw that
Samina's internet is not
rubric,
working.
but I use complete and I get yeah, the rubric which I showed you, na, that
Samina,
optimism side of
complete repertory is just recently edited by Dr. Rajesh Rajendran from Chennai. That's why they have added so many remedies to that. But I'm really worried about the sources of those remedies. That's why I don't follow complete remedy. Because nowadays various doctors are
okay.
adding various symptoms, but they are basically clinical symptoms. So how much we can rely on that, I don't know. I usually go with what already has been proved in a traditional way, because in foreign, in Europe where I work more, they are very much sensitive about the sources of the remedy, and me too now.
Okay, thank you.
I think here
Hello,
we.
ma'am.
Hello.
I
Is there any
also
question?
want to ask a question.
Yes,
Yeah,
yes.
ma'am.
Hi Shruti.
Hello, ma'am. How are you?
बढ़िया हो, तुम भी थी यहाँ, पता नहीं चला, अभी पता चला, बोलो.
No, ma'am. I was writing so many answers.
Oh,
You
but
praise me in between
okay,
also.
okay, yeah. How are you? Okay.
I'm good, ma'am. How are you?
Fine, fine.
Ma'am, I want a guidance for psychiatric cases. You deal so much psychiatric cases. You are an inspiration. Ma'am, I got one case in which this girl of 25 years, she is obsessed with her hair. She has very good hair, very long and fine, but she feels that she is losing. She doesn't have hair fall, but she feels that she is getting bald, and it is on the psychiatric level now. And I took her history, and she came like a Netramure patient to me. So I gave Netramure. All her symptoms, physical symptoms, are stopped, like no hair fall, no other problems are also got resolved. But it is in her mind that she is not having good hair. If she will become bald? She keep on seeing like people on road that she has good hair than me. Then how to deal these patients? Like we should counsel, or what to do? How to counsel them, console them? No, there is no hair fall. I keep on telling her, but she doesn't understand.
Shruti, there is one rubric. मुझे अभी पूरा याद नहीं आ रहा है rubric, because मैं अभी एग्जाम के लिए आई हूँ, परभनी सुबह से ट्रैवल कर रही हूँ. So I actually can't able to remember the whole rubric, but let me tell you one thing. There is a rubric in Ignatia, fear or disappointment from losing the objects, disappointment from losing the organs also. Like that, there is a rubric. Open the repertory and you will get it. So in your case, actually she is not losing anything, but it is
No.
just a sensation. And this sensation is anticipation, you can use the word, or fear, or fright, or some stress because of the sensation that I'm losing something. I'm losing the organ, disappointment, or anger. So, ignitia is the best remedy in such cases. So, I think you should do this. And she is in the delusion. So, there is no need of counseling. If you read Organon, Hahnemann has clearly mentioned that you can counsel the patient who is having true mental disease. Who is not having true mental disease, you cannot treat the patient. But she is under the delusion. It is not her mental disorder like schizophrenia, and you are getting any organic change in the brain. So it is just a delusion. Her sensation, her feeling. So there is no need of psychotherapy or any type of counseling, because if you will counsel her, it will aggravate her.
Okay, okay. No, ma'am, because I gave in between ignitia dose also, because it all started with her grandma's death. She was very fearful, so I gave her ignitia as well, thinking both the symptoms are matching. But then again, the same thing is in her mind. Her mother is here. Then she was also telling that she keeps on looking in the mirror
But
after your
Shruti,
medicine.
did this symptom start after grandma's death, or the symptom of losing hair was there previously also?
No, after grandma's death, the first symptom was that she was in the shock because she was in very close. But then after 2-3 months, this hair symptom started. And before she used to, all the time she used to see the mirrors and every time take the photo. Now it is 1 or 2 times in a day, but it is in her mind, and every family member is like troubled what to do, how to console her.
Nothing. Just tell them not to discuss the same thing again and again. Don't remind her. It's better. And what potency you have used in ignitia?
200, ma'am.
200 doesn't work, Shruti. It's a case of on psychiatric level. So it's better to go with 10M. Ignitia 10M. If you are not sure of that, give Ignitia 10M aqua dose, single dose. That will work for her. And you know, usually when the case starts after grief, Ignitia is not only the remedy. Acid phos works much better.
Which one? Phosphorus?
Acid phos.
Acid phos. Okay, okay.
So read both the remedies
Yes.
and then decide
Okay.
yourself. Okay?
Okay.
So any more
Thank you so
questions,
much.
dear?
Shama is asking Wi-Fi proving reference any of, if you have any.
Wi-Fi proving symptom where to look for. See, if I will prove, I will give you everything ready in the platter, then what will you learn, darling? If even I tell you how to find out the remedies or the knowledge of the remedies on Google, then it's really difficult here. Do something by your own, isn't it? I'm here to teach you fishing. I'm not here you to serve the fish, ready fish in your platter. Try. If I could find it, you can do it. बराबर है ना तकसीम?
Right, ma'am.
Taksim, could you please leave me now? I have to.
Thank you so much, ma'am. I think we'll wind up the session for today. Thank you for sharing such lovely cases. Hope to see you soon on Homeopathic Musings.
Thank you so much. And somebody here is writing that use backflow remedies, such obsession, fear, anxiety of losing something. Thank you so much, Jyoti. Your suggestion is really good. But I never use backflow in my practice because I feel that it is for partial palliation. It can cure, it can palliate the symptoms for a while, but ultimately, if you want permanent cure, I think homeopathy is the best. And we have everything in homeopathy. So why to go for backflow or other? This is my personal opinion. I don't want to hurt anybody. If you are using it, it is well and good. But I guess homeopathy is the complete one. Thank you. Bye.
Thank you, ma'am.
Bye, everyone. See ya. Bye.